Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. There was a connection issue and sorry for that. So today I wanted to talk about signs of labor. Pregnant couples are very apprehensive and at times they keep thinking about labor and delivery even before it comes, and they want to be prepared and they want to keep everything ready, and they want to know how it is and all that. And thinking about labor and delivery before it comes definitely is a sign of more apprehension, and also it kills the actual presentation scenario how you are in. So you should always have an open mind, and anything that is abnormally sensed by you should be reporting to the hospital or to the doctor. That is what I keep saying. And if I say there are 10 signs of labor and you have another 11th or 12th symptom, then definitely you will be thinking that this is not what the doctor has told. So even though it is abnormal, I think I have to wait and then go to the hospital later. It's not like that. Every body is different. Every pregnant woman presentation is different. Every time it's a different kind of a scenario that you present in labor. So there are some common signs of labor that I wanted to discuss, so that if these symptoms and signs are presenting, then probably you should be alert and you should reach out to the hospital as soon as possible. And when you are nearing, say, some people deliver at 37 weeks, some people deliver at 38 weeks, some deliver at 39 weeks, some deliver at 40 weeks, and some even deliver at 35 weeks. So there are different scenarios and different conditions that we actually have in obstetrics. And obstetrics is all about variability, and obstetrics is all about different scenarios. So there is nothing called as this symptom or sign should be there for labor to start. So we will discuss today about some scenarios that will help you recognize any early signs of labor, and those symptoms and signs are very important to reach out to the hospital. There are people who have labor contractions and severe pains, and they call and ask the doctor, do I have to start? Any symptom and sign that is an abnormal, that you're observing it abnormally, you have to first reach out to the hospital and not call the doctor. What I say is, if you reach out to the hospital, there will be an assigned staff to check whether you are in labor, you are not in labor, or if you are not in labor, they'll reassure you, they'll make sure that you listen to the baby's heart and they get you back to your home. And if you are in labor, then they will contact the doctor and say that these are the findings. This much is what she's showing up, and this is the labor findings, and then the doctor gives the instructions out of admitting or not admitting, or what medications to be given, what not to be given, is an admission necessary or not. These instructions will be given by the doctor when you actually go to the hospital, and the hospital people recognize these symptom signs and define it in a medical language and explain to the doctor. Rather than you calling up the doctor and alerting, and it is of no use, because you cannot explain the medical language that the sisters or the junior doctors will try to give information about you to the doctor. So it is always important, when you have these symptoms and signs, you reach out to the hospital to check the progress or to check whether you are in labor or not. And when we have to talk about the onset of labor, as I have told you, it's absolutely different for different kinds of pregnancies and different people. But yes, one common thing can be an onset of contractions. Contractions are something that you feel severe crampy pains that are coming from the back to the front of the pubic bone, and then from the sacrum to the pubic bone. So they are almost cramps that increase in intensity. So there are false contractions also, which are called as Braxton Hicks contractions. Around 4 to 5 or 7 times in a day, you feel that the uterus becomes stone hard, and then you have a contraction that weans away, and again for about 4-5 hours you don't get anything. So this is not that type of a contraction. In this contraction, you will get in about regular intervals, say around 15-20 minutes once, say, or half an hour once, and the contraction keeps increasing in intensity from what it has been in the last time. So it is very important that you keep you just notice anything that is abnormal and increasing in intensity, and the crampiness has been a part of that annoying pain that you're getting. So this is one of the symptoms and signs of what labor contractions can be. And sometimes people have this bloody cervical discharge, and they panic and they say that, oh my god, it started bleeding. No, it's not that. A bloody cervical discharge is a sign of the it may progress to labor when the cervix or the mouth of the uterus opens, and it's starting to open, and it can happen even a week before. So when it starts to open, the block of mucus that it actually blocks the cervical canal just loosens and comes out. So along with it, you can have a bloody discharge or only a mucus that comes out. And it is not mandatory that this thing happens on a regular basis. This can also present, and you need to be very watchful of this. Certain people are so much pain tolerant, even if they are having cramps, because they have been having these cramps for a very long time. They don't concentrate much, and for them it is sign of it has been there since a very long time. But for such people, suddenly a belly button pain appears, and lower back pain appears, and it is not allowing them to sit down or sleep or lie down or do any activity. Then you have to be alert and you have to come to the hospital, thinking this also as a sign of labor. If you're full term, basically, even belly button pains have to be noted on, and sometimes severe sacral pain or backbone pain can also present like this. And there is always a cinematic expression of people in the movies and all that. They express, oh, my water broke. So this is one of the presentation, but not always a presentation of the onset of labor. Usually what we tend to do is, when we examine you in the hospital and when we try to see the findings, whether you are going to go into labor or not, usually I do this, and when I feel that yes, you are about to enter into labor and you will be going into labor in 1 or 2 days, I make an elective admission so that you don't panic in the house with water breaking, and you don't come in a panic mode, oh, my water broke, and we'll also be tensed whether where the cord is, has the cord come out when the water broke. All these things are critical, very important things, very rare, but who presents with what, we don't know. So we make sure that you are addressed and given a situation wherein you're safely in the hospital without all these things happening in the house. And there is so much of panic, there is so much of commotion, there's so much of gross tension that happens when your water break and you're here, there, packing everything. So I always tell them that you might have the signs coming in, so you better pack everything and keep things ready, or if you have slight cramps, just come to the hospital so that we'll address to the scenario. And water breaking is also one of the symptoms that you will go into labor eventually. And unfortunately, some people water break happens a little early, so for them we need to manage in a different way. For somebody whose water breaks at term, after 37-38 weeks or at 40 weeks, they should not worry and they should come to the hospital. This is one of the symptoms and signs of labor. And when the contractions increase very frequently, then again it is very clear that it can be the labor contractions. And for some people, they give a very peculiar sign. Till yesterday, doctor, I was feeling very heavy and my chest was heavy and I was having acid reflux and I was not able to sit down and I was not able to sleep. Now, I feel that I feel lightening, and I feel that my baby has little dropped and I don't feel that choking sensation and I don't feel that heaviness anymore, and I'm able to eat something, and my breathing has little become better. For people who have had baby till 36-37 weeks till here, their breathing is difficult. Now suddenly they'll have relaxed breathing. So it means the baby has entered the pelvis. So once the baby enters the pelvis, it means that it is preparing the body to go towards labor. So this is another imminent sign that you will progress into labor eventually, and that is not one symptom that labor will happen today or tomorrow. Yes, that's an alert symptom that you know that you can even notice. And for some people, the cervix starts opening. So this cervical opening is recognized by the doctor. So that is what I do whenever a woman comes in the last few days of her pregnancy, maybe around 37, 38, 39 weeks. I examine the cervix and whether the cervix is opening. If I see to it that the cervix is opening and the symptoms and signs are good, and the 3 days back it was 1 centimeter and now it is 3 centimeters, I tell them you're very good. You've got very good signs of labor progressing, and so you better get admitted and get yourself delivered in the hospital under the supervision of the staff, so that you won't land into an emergency situation anytime midnight or early morning or something like that. So whenever the cervical findings are good, so we score the cervix by method called a Bishop scoring. If the Bishop scoring is good, then we try to get them admitted and make them go through labor and delivery smoothly. And whenever the Bishop scoring is really good, the chances of them delivering normally is extremely high. And sometimes if they have a notion of maybe doctor, I want to deliver over this weekend kind of a thing, and her Bishop scoring is absolutely good and she's term, nothing wrong in getting her delivered over that weekend. You can do that. As a matter of fact, it's easier when the scoring is good to deliver the woman safely in the hospital. And when your cramps increase and when your back pain increases, don't panic. Come to the hospital. There is an equipment called as a CTG machine or an NST machine which we connect and monitor the baby's heartbeat for 20 minutes. In that, during the labor contraction, which is also picked up by the machine, the baby movements are there and the heartbeat variations are there. So all these things together, we can know whether you are in labor and whether the baby is safe, whether the heartbeat is good, and whether it is actual labor or not. So that gives you an insight into whether you need admission or whether you need to go back for the cramps or pain that you're complaining of. And sometimes, just before delivery, your joints and all feel so loose. You feel as if you don't have grip in your body, and you feel that you have a falling sensation, the knee or ankle or the hip joint. All these loosen up because the effect of hormones because the effect of the labor and delivery that actually is going to take into the body. There is loosening of the joints, and you will feel that very peculiarly. Some people say that I feel that looseness in my joints, I'm not having that good stability, doctor, what I should do? So loose feeling joints can be one of the symptom and sign of that you might go into labor and delivery, and you need to be very watchful. Some people have loose motions, and that is also one symptom and sign of labor imminent, because this is diarrhea of labor that we talk about. Because when the head comes down completely and when the cervix starts opening, there is a tendency for people to have loose motions. And when we examine, yes, it means that you can go into labor eventually in some time. So the diarrhea of labor pains can also be one of the factor that you need to be very alert. At that time, you should not pop in antidiarrheal medications and stop this and all that. You just have to report to the doctor, and the doctor will take care. People with constipation do not go that easily into labor. So that is why even in the end, the last few weeks of pregnancy, people make sure, your doctor will make sure that you do not have any constipation. And home remedies are also all around giving you clear bowel. That improves actually the labor process. And constipation is an absolutely no when you are supposed to be going into labor. And one important thing, people panic in the hospital saying that, doctor, I lost 1 kg in this week, will it affect my baby? I always tell them, losing 1 or 2 kgs in the last few weeks of pregnancy is not a bad sign. It is a sign that you might enter into labor. That is one of the signs that I always tell them. It's nothing to worry. People actually lose 1 or 2 kgs in the last 1 week or 10 days of pregnancy, that is an imminent sign that is telling you that you might go into labor spontaneously. And people, but I can really recognize when somebody walks into the OPD with a full term and a sick look on their face, and they say that doctor, she's not been feeling well, and she's keeping calm and she's become dull and all that. I always reassure them, telling that that's one of the symptom and signs of labor and delivery. So she's going closer to labor and delivery. That's why she's keeping herself she's keeping herself calm, and that's a symptom that we called as nesting. And our body recognizes that symptom and sign and keeps saving energy for the labor process, and it cuts down all the unnecessary work and hush that you're doing around the labor time. And that is one of the identification factors. They keep telling me, చూడండి డాక్టర్ మొహం పీక్కుపోయింది. So I tell them it is not about dullness that has come. It means that she might go into delivery and labor sooner. So you need to be very watchful about such symptoms and signs, which are really, really important. And there are some peculiar symptoms and signs, like people lose some taste sensation, people have recurrent headaches, and people have leg cramps and leg swellings, and people have symptoms of people have symptoms of fissures and piles, and sometimes bleeding because of the head that has got fixed and a lot of pressure in the abdomen. So these are some not always present problems, but yes, you can be very watchful about those things. And there are also very different kinds of symptoms and signs where people would like to eat something hot or cold, or would like to they have a different kind of taste sensation that happens. And sometimes people have magically they have a sense of saying that, doctor, I am feeling that my baby has dropped and I might go into labor sooner or later. So this is also there. And predictions, as a mother, she'll be the better person to tell that what lightning is, what kind of additional positiveness that she's going to feel about labor and delivery. So this is all about signs of labor and delivery. And it's all about being watchful. It's all about reporting to the hospital in time. Nothing that you call the doctor and the doctor will miraculously tell you that, oh, I think you're in labor, you should go to the hospital. It is better that you go to the hospital, check yourself, and if you're not in labor, they will eventually send you back to home. If you're in labor, they'll inform the doctor the findings, and the doctor will advise for admission as per the required necessary things. And people are sensitive at that point of time. They have trivial questions and a lot of doubts, and I always tell them, you have to write down whatever you have in terms of your doubts and keep asking them. Keep asking on a relevant basis, because if you carry the doubt to home, again, there's nobody going to be there to answer you correctly. So it is important that you take the answers from your doctor, and do not Google things, and do not actually call for experiences of others, because you're killing your experience. I always tell that, wait for your body to show some kind of a reactivity where you will have your own experience, and do not live by others' experience. So that is very important, that you live your pregnancy by your terms, and you enjoy your pregnancy by your terms, and not by somebody else's experiences, and not by somebody else's the 10 points or 20 points or 30 points. And it's always about your pregnancy, your priority, and your experience. And do not always Google about things, because Google is not going to raise your children. Google is not going to take care of your pregnancy. It is you have to take care of your pregnancy. And yes, there is an information pandemic that is running. So in this information pandemic, you need to keep up to your own your own self, and you have to experience your pregnancy and delivery coming forward. So this is about signs of labor, and being alert, and being vigilant, and enjoying your pregnancy. See you tomorrow, yet another super healthy super morning, and bye. Thank you so much for watching.